Hi guys, the electrolyte relationships that I'll be discussing are sodium and potassium and calcium and phosphorus. So what are fluids and electrolytes? Fluids are basically liquids, and fluids in our case for the body, it's water, and it makes up about 60% of the total body weight. There's ICF, which is intracellular fluid, and this is about 2/3 of the total body water inside the cells. And ECF is the extracellular fluid, which is about a third, and it's interstitial fluid or plasma. And basically, how this works is water usually, or the fluids, water in this case, follows electrolytes, especially sodium in our case. Um, and this is usually governed by osmosis and hydrostatic pressure. Hormones like antidiuretic hormone, ADH, and aldosterone regulate retention and excretion of fluids. What are electrolytes? Electrolytes are basically charged particles in body fluids, and these can regulate nerve impulses, muscle contraction, acid base balance, and hydration and osmotic gradients. So I'll be talking about sodium and potassium. So sodium is the primary extracellular electrolyte, fluid electrolyte. So this is basically meaning that the electrolytes on the outside of the cell, like usually hovering outside the cell and such. Potassium is the primary ICF, which is intracellular fluid electrolyte, which is inside the cell. And how is this? This is basically maintained by sodium potassium pumps, and they're essential for nerve impulses, like nerve impulse transmission, muscle contraction, cardiac rhythm, and maintaining cell membrane potential. So, what increases? Why do they increase, or why do they decrease? So, sodium is usually elevated or increases due to dehydration, hyperaldosteronism, and Cushing's disease. And sodium is usually decreased due to vomiting or diarrhea, syndrome of inappropriate antidiuretic hormone, which is SIADH, diuretics, and fluid overload. And for potassium, they're usually elevated due to renal failure, acidosis, and medications such as ACE inhibitors and potassium sparing diuretics. Their potassium is usually decreased due to diuretics, alkalosis, vomiting, and diarrhea. So, what are the nursing interventions for some of these situations? So, for hypernatremia, the nursing intervention would be to first monitor neuro changes of the patient. And what we can do is give them hypotonic fluids and also limit their sodium intake. For hyponatremia, the best course of action would be to restrict the fluids if it's a syndrome of inappropriate or SIADH, or hypertonic, give them hypertonic fluids. And then next thing we should do is monitor for seizures in our case. And for hyperkalemia, which is a high potassium, we should always monitor their cardiac rhythm and such. Their basically the heart rate and everything, the heart. And what we should do is IV insulin plus glucose, give them calcium gluconate and Kexalate. For hypokalemia, what we should do is give an oral or IV potassium chloride, no push, and ensure that they're having a potassium-rich diet of some sort, like foods in their have potassium-rich foods within their diet. And what we should do, of course, is monitor their EKG changes. So, why is it important for imbalance correction? Like, what's the significance? It's critical to correctly balance these electrolytes because the imbalances of sodium and potassium in our case would cause arrhythmias, seizures, muscle paralysis, and weakness, muscle paralysis, weakness, or muscle weakness, respiratory issues, altered mental status. And these are basically the reasons to correct and why it's significant to correct these imbalances, because they're essential to cardiac, neurologic, and muscular function. So the next two relationships that I'll be discussing is calcium and phosphorus. So calcium is the primary ECF electrolyte, phosphorus is the primary ICF electrolyte. Calcium and phosphorus have an inverse relationship, so if calcium goes up, phosphorus will go down, vice versa. And they're usually regulated by the parathyroid hormone, PTH, and vitamin D. So if PTH increases, calcium by lowering phosphate, essentially. They are essential for nerve impulse transmission, muscle contraction, cardiac rhythm, and maintaining cell membrane potential. So why is it increased or why does it decrease? So calcium is usually elevated due to hyperparathyroidism or excess vitamin D or calcium intake. It can be decreased due to hypoparathyroidism or renal failure and low vitamin D intake. And for phosphorus, it can be elevated due to chronic kidney disease or cell lysis, or hypoparathyroidism, inverse relationship of hyperkalemia, calcemia. So for phosphorus, it's decreased due to hyperparathyroidism, malnutrition, or alcohol abuse. So some nursing interventions that we can do what are some nursing interventions? Some of the nursing interventions that we can do for like hypercalcemia would be increase the hydration, which would increase renal excretion, pee more, administer loop diuretics, and avoid calcium. What we should do is monitor for those signs, Chevek's and Troisios signs, tetany, laryngeal spasms. For hypocalcemia, we should administer oral calcium supplements with vitamin D, increase dietary calcium, and monitor those signs again. And for tetany and laryngeal spasms. For hyperphosphatemia, what we should do is use phosphate binders with meals, limit phosphorus foods, and monitor their phosphorus levels. For hypophosphatemia, what we should do is administer oral or IV phosphate, encourage phosphate-rich foods like meats and nuts and grains, and then we should treat the underlying cause usually, like alcoholism or malnutrition, whatever that may be. And why is the imbalance correction, why is it important that we correct the imbalance? It's critical to correctly balance these electrolytes because imbalances can cause cardiac arrhythmias, seizures, muscle spasms and weakness, bone pain or fractures, and delayed healing and fatigue. They're basically calcium and phosphorus are essential to bone strength, cardiac contractility, neuromuscular function, and ATP production, cell repair, and acid-base balance. So I talked about basically both the electrolyte relationships and such. So these are questions that I may have for you guys. If a patient has CKD, how should we prioritize treatment for calcium phosphate imbalances and why? And then what nursing intervention should we implement for a patient experiencing symptoms of like hypokalemia, hyperkalemia, hypernatremia, hyponatremia? You guys could choose any of the, excess or hypo or hyper symptoms, but just let me know what would be the best intervention for each one. And yeah, these are my references for my EBP resources. Thank you guys.